Carmen here, and I thought I'd just put together a video just to share with you some of the things that you need to take into consideration if you end up in a situation where somebody in your home is positive for COVID-19. So remember that the majority of people who get COVID-19 infection will recover at home. Only a small percentage of people will get severe disease and they will require admission into hospital. We know that the groups who tend to be at risk for severe disease include people with underlying medical conditions as well as the elderly. There are definitely people who fall outside of this general rule, but the majority of people will be at home recovering from COVID-19 infection. So I thought I'd just share with you some things to keep in mind, some things to consider. This is going to be a little bit of a longer video, but I've divided it into some general things, some things to take into consideration if you are the patient, and some things to consider if you are the caregiver and the family. So if you want to learn more about some of the safety precautions that you need to be taking if somebody in your family tests positive for COVID-19 in your home, then stay tuned. So it helps to remember that COVID-19 is a respiratory illness, meaning that it is spread via things like droplet infection. So if somebody coughs or somebody sneezes, and some of those tiny particles can also hang in the air in what we call aerosol. In addition, some particles can end up on surfaces, and so if you touch a contaminated surface and then touch your face or touch your mouth, then you can spread the infection in that way. It helps to remember that when you are taking care of somebody in your home with COVID-19 infection, because it will give you an idea as to some of the things that you need to consider in order to prevent yourself from getting ill. Now, the ideal situation would be that if somebody in your household is positive for COVID-19, that they get to stay in a separate room, separated from the rest of the people in the household. Now, this may be very difficult for some people, and depending on your living arrangements, it may even be impossible, but the ideal situation is that the person who is sick is isolated from the rest of the family in their own room with the door closed, in order to ensure that there's no cross-contamination and aerosols coming through, for example, from the room into the rest of the home. So just think about your own situation, and as I said, it may not necessarily be possible for you, but that would be the ideal situation. But as far as possible, the person who is infected should be remaining at a good distance away from the rest of the people in the household. It also is important to remember that ventilation in the room where the sick person is needs to be observed. So in other words, it is preferable for the window to be kept open in that room, provided that it's not too cold, just so that the air can start to circulate and the viral load or the particles in the air can be diluted by the fresh air coming in through the window. Now, it's uncertain as to how long those particles can remain suspended in the air, and it's also uncertain, certain surfaces, the viral particles may be able to remain viable for a longer period of time. This also depends on things like the environment and the humidity, the type of surface, etc. But it's important to remember that potentially viable viral particles can be on all the surfaces in the room where the infected person is staying. It's also important to remember not to share things like cutlery and plates and cups and towels and face cloths, for example. So all of that should be kept separate for the person who is the patient, and the rest of the family should of course be using their own cutlery, etc. Okay, so here are some considerations for the caregiver. So the person who is designated to take care of the person who is COVID-19 positive. It's advisable to choose one designated caregiver if the person actually needs assistance, but one person to take care of that person, and it should preferably be somebody who is able to do so and the healthiest person in the household. Remember that we don't want to expose anybody who may be at risk for severe disease to somebody who is positive for COVID-19. So as far as possible, the caregiver should be the healthiest person who's able to render the services that the sick person needs. So just some things to take into consideration if you are the caregiver is that you should be protecting yourself appropriately. So it depends on what you have available to you. If you are able to access disposable gloves, then you should be getting hold of that. If you are able to access some goggles, that would be good as well. And then remember that everybody is advised to wear a cloth face covering. So that includes the person who is taking care of the person with COVID-19 infection. Remember that the regulations or the guidelines say that medical grade masks like surgical masks and N95s should be reserved for healthcare workers and first line responders. So as long as the patient is wearing a cloth covering and as long as the caregiver is doing the same, then that should be sufficient if you are taking care of someone in your household. Now, just a little bit on how to appropriately wear a mask. The mask should be covering your nose and it should be covering your mouth, going over the chin area as well. There shouldn't be any gaping holes on the sides. And as far as possible, you should be not touching the front of the mask and not adjusting the mask too much to ensure that you're not contaminating your face by inadvertently touching the mask so often. So just make sure that if you are wearing a mask that you are doing so appropriately so that you're protecting not only others but also yourself. Just remember also that the use of cloth masks is really not to prevent you from getting infected. Rather, it's to prevent the person who is infected from sharing and spreading their droplets and aerosols out of their mouth and nose. If it is possible for you to wear some kind of protective clothing, like for example an overall, or even if you have an apron just to form another additional barrier between you and the patient, then that would be good, but it's not absolutely necessary. Just remember that after you've had contact with the sick person that you should be washing your hands thoroughly for at least 20 seconds. You can watch this video if you want to just make sure that you are covering all the areas of your hands that need to be covered when you are washing your hands. And then even though you are designated to take care of the patient, depending on that patient's needs, try to keep your distance from that person who is sick as far as possible. So, for example, if the person doesn't really need you to assist them with anything, then just make sure that you are limiting contact with the person who is ill, that you are going into the room only when it's absolutely necessary, and that you are taking the appropriate precautions to keep yourself safe. And then a few things to consider with regards to taking care of the person who is sick. Remember that people with COVID-19 infection, this is a viral infection, so in a lot of cases people will have a fever, so they will be sweating and losing fluids. So just ensure that you are making sure that the sick person is staying well hydrated. So it can be helpful to keep track of the patient's symptoms. Depending on how sick they are, they may be able to do that on their own, but you may also want to keep a chart and just make sure that day to day you are monitoring their symptoms just to make sure that the person is on the road to recovery. Some other things that you may be able to do is ensure that the person is kept warm and dry. Sometimes with drenching sweat, for example, the linen may be soiled and may need to be changed. So just make sure that you're keeping on top of things like that. Also ensure that if you're able to, you're keeping track of the person's temperature. If you're able to get hold of a thermometer, that would be very helpful just to be able to monitor and track their fever. So some of the danger signs to look out for if you are taking care of somebody who is sick include things like shortness of breath or difficulty breathing. You may even notice that the person's lips are turning blue, or even their tongue may be turning blue as well. That's an indication that the person needs urgent medical care and that perhaps they're not getting enough oxygen into their bloodstream. So keep an eye out for that. In addition, the person may experience things like confusion and even dizziness. These are general danger signs and things to look out for. But remember that if a person has an underlying medical condition, there may be additional things that you need to be looking out for. So make sure that you are communicating with the healthcare provider of the patient. But for example, somebody who is diabetic may experience high spiking blood sugar levels, or they may experience a drastic drop in their blood sugar levels. So those are some of the additional things that you may need to take into consideration if the person that you are taking care of has an underlying medical condition. Also, ensure that you have the emergency number for the ambulance service in your area at hand, and that you also have the contact number of the patient's healthcare provider at hand, because you may need to discuss certain symptoms as they arise, and you may actually also need to call for an ambulance if the person needs urgent medical care. Just remember that when you are calling for an ambulance or calling the healthcare provider and you may need to take the patient into the doctor's office or into the hospital, that you notify them beforehand that either you have a confirmed or a suspected COVID-19 patient, depending on whether the patient has been tested or not. So when you are changing the linen of the bed of the person who has COVID-19 infection, just make sure that you are doing this as carefully as possible. If you are able to, wear disposable gloves, and ensure that when you are removing the linen from the bed, that you remove it from the four corners of the bed and kind of fold it inwards, and ensure that you're not shaking the linen out or putting it on the floor. And also don't grab it and take it close to your body as well. If it helps, you can have a bag available and just put the linen in the bag to transport to wherever it is that you're going to be washing the linen. Ensure that you wash it in warm water with a good detergent, and that you're washing it immediately and not leaving the linen laying around to expose it to other people. Just some important tips about glove wearing. Oftentimes people wear gloves and they get like a false sense of security when they're wearing their gloves. In a similar way, when people wear masks, they can kind of feel that when they're wearing the masks and the gloves that they're almost protected just by doing that. Just remember that disposable gloves should not be reused, and ensure that when you take the gloves off that you are disposing of them immediately, that you're not leaving gloves lying around. And just ensure that when you take the gloves off, immediately that you go and wash your hands thoroughly. So high-touch surfaces will need to be regularly disinfected. If the person who is positive for COVID-19 is able to do it on their own, then they can go ahead and disinfect the area, things like tabletops, light switches, doorknobs, cell phones, tablets, keyboards, etc. However, if you are the caregiver, you may need to do this on behalf of the patient. Depending on how much contact you have with the sick person, you may not necessarily need to do this on a daily basis. However, if there are some common areas that you will be in contact with, then ensure that those areas are disinfected regularly. Okay, and so now some things to consider if you are the patient. Remember that you obviously should be keeping your distance from the rest of the family, that you should be washing your hands regularly for at least 20 seconds. You should not be sharing anything in common with the rest of the household. You shouldn't be going into common areas unless it's absolutely necessary for you to do so. Another thing to consider if you are the patient is that COVID-19 virus can be shed in the stools. So something that you will need to make sure of is every time you go and relieve yourself in the toilet, that you are covering the lid before you flush, just to ensure that you're not getting, and this is the visual, but you don't want to get aerosol particles that are coming out of the toilet that are landing on the surfaces around. So excuse me for the visual, but it's true. So every time you go into the loo and flush the toilet, ensure that you are closing the lid before you flush. It's also preferable for the patient to have like either a plastic packet or a bin with a liner in it, just for things like tissues that may be contaminated, and ensure that those are getting disposed of immediately, that you're not leaving them lying around. And then the caregiver will need to ensure that the waste is disposed of safely. It's preferable to put it in 2 bags before you dispose of it with the rest of your general waste. In addition, as the patient, if you are in a room and there's nobody else in the room, it's not necessary for you to wear a mask. But if somebody does come into the room, please make sure that you are wearing a mask and that you are wearing it appropriately. And then in addition to that, make sure that if you are coughing or sneezing, that you use a flexed elbow or that you use tissues and then dispose of those immediately. And then if you are the patient, ensure that you are getting enough rest and that you are staying hydrated. It's very important for you to be drinking a lot of water and things like herbal teas, for example, because you want to ensure that your body is able to fight this infection as quickly as possible. Remember that when you have a respiratory illness, it's important for your mucous membranes to be moist, because you want to be able to get out any viral particles, any mucus that may be starting to collect inside your respiratory tract. And the only way that you can do that is if you stay hydrated. So it's vitally important, if you are sick with COVID-19, that you stay hydrated. Also take your supplements. If you are able to, please eat. But as long as you're staying hydrated and as long as you're resting and taking your supplements, then you should be able to get over this infection. I hope that that helps, and I hope that you now have a bit of a clearer understanding about some of the considerations to take if you are in a household where somebody tests positive for COVID-19. If you found this video helpful, please go ahead and click the like button and subscribe to my channel and hit the bell so that you get notified every time I post a new video. Thank you so much for watching. If you found this helpful, please go ahead and share it. Take care of yourselves and stay safe.